Hey, good morning. I'm calling this meeting of the House Children and Families Finance Policy Committee to order. We do not quite have a quorum. It's a snowy day, and I know a number of folks are running late, so we will forego the roll call and hold off on our minutes until we do have a quorum. So our first item of business is a presentation. We're going to have a series of bills, 3 bills relating to child care and early learning, with the first or series of proposals, I guess I should say, with the first 2 about facilities. And if I can ask Jennifer Sommerfeld from Department of Human Services to head to the front. We're going to have a presentation regarding the governor's capital bonding recommendations in that area. And then after that, a bill regarding child care facilities as well from Representative Lee. Ms. Sommerfeld, welcome back to the committee. If you can please identify yourself as usual and then proceed with sharing some information about the administration's proposal.
Great. Thank you, Mr. Chair, members of the committee. I'm Jennifer Sommerfeld. I'm the Legislative Director for Children and Family Services at DHS. I'm going to give a very brief presentation on the governor's capital budget proposal regarding early childhood facilities. The governor's capital investment proposal for statewide early childhood facilities provides $3 million in general obligation bonds and $2 million in general funds for grants to political subdivisions, tribal governments, nonprofits, or licensed child care centers or family child care providers to construct new early childhood facilities or renovate aging substandard facilities. The grants are intended to help providers create more equitable access to childcare and age-appropriate, high-quality early learning programs. They align with the governor's One Minnesota plan that prioritizes equitable outcomes for children and families and increases access to affordable, high-quality childcare for Minnesota families. The grants will be awarded through a competitive RFP, which includes a 25% match of non-state funds, and the 25% is a change. It previously was 50%. Projects could include creating classroom space with restroom access, cubby storage, parent spaces, indoor-outdoor large motor skill facility areas, prep spaces, adding to secure entry and exit, and so on. Projects may also include program collaboration among early childhood providers or child care providers. So a Head Start with a school age program or a private child care center could collaborate with another one to develop a project. A grant for individual facilities or providers must not exceed $500,000. If there are multiple programs housed in the same facility, a project for each, if there's different programs, they could each get a grant if needed for up to $500,000, but the overall maximum grant for that facility would be $2 million. And this funding's in the budget to serve as a catalyst for collaboration between cities, counties, and school districts to improve early childhood facilities and promote better outcomes for children. This next slide shows just a little bit about the programs or the projects that have been funded over the years. Since 1992, 75 projects have been completed, 57 of which were in greater Minnesota and 18 of which were in the 7-county metro area. Last session, the bonding bill included $2.025 million for early childhood facilities grants. We have not yet put out RFPs for those proposals, waiting to see if we are able to gather more bonding funds this year to have a greater pool for folks to apply for to help get money to more facilities. And then I'll just note that since '92, the total spending on this program has been $23 million in general funds or GO bonds. And prior to last session, we have had no funding since 2014.
Thank you. I'll maybe just ask you to clarify a couple things. You just said $23 million in general fund and GO bonds, general obligation bonds?
Yes, that's
like in
combined.
total?
I don't have the breakdown right now.
Okay. And then can you remind me as well, I guess you're saying that the most recent funding was in 2014. I had thought that there was a proposal from the administration that had been funded. In fact, it may be that Ms. Mock may be able to help me with this. She looked at this. I thought that there had been funding in this program since 2014 that had been proposed or otherwise. But I'll go to you first, Ms. Sommerfeld. Maybe Ms. Mock can help. But
sure.
Yeah, Ms. Sommerfeld.
Thank you, Mr. Chair, members. My understanding, from what I've been told, is the last time funding was actually appropriated. I think it had been requested multiple times, but the last time it was appropriated was in 2014, prior to the funding last year. I agree.
Okay, but the funding so then if we can describe the funding last year, maybe Ms. Mock can help with that, or well, we'll go to Ms. Summerfeld then, sure.
Yeah, Mr. Chair, members, last year we received $2.025 million in a combination of general, 900 of which is GO bonds and $1.125 million is general fund funding. So that's what we received last year.
And so and sorry everybody for asking these questions, but hopefully it's helping your knowledge too. So then the prior slide showing the map that ends in 2014, presumably then there will be, regardless of additional funding, there is that additional $2 million that's going to be going additional dots on this map eventually.
Mr.
Yes.
Chair, members, yes, that's correct.
Okay, thank you. Okay, and other questions other folks have about this? I made just one other clarifying question, Ms. Summerfeld. The $5 million proposal, how broad is the, can that funding be applied? I'm thinking about the bill we're about to hear. Maybe we'll save it for that. But the Representative Lee's bill, are these, there's a 25% match, but otherwise, for example, if there's small renovations to facilities, is that something that in theory would be eligible for this funding?
Mr. Chair, members, prior to now, that has not been how the funds have been used, but we are hoping that there will be more access for family child care providers and other providers who would have smaller requests.
Or even child care centers that want to
Yes.
like renovate, okay. And what will it take to do that, to have that change? Do we need to do anything, or is that just something that that DHS would be doing?
Mr. Chair, members, these are bonds that DHS will be managing,
Okay.
or DCYF at some point, and there will be an RFP and application process.
And you
as
can do
always.
that then, okay. Representative Katiza-Batoon.
Thank you, Mr. Chair, and thank you, Ms. Summerfeld, for bringing this presentation forward. I think it gives us a really good idea of the supports that childcare providers need all across the state, and whether it is a family in-home provider or childcare center. I was speaking with the executive director of Women Venture recently, and she was actually telling me how impactful it can be for a home-based provider to like blow out one of the walls of their home so that they can expand like their childcare space and potentially be able to care for more children in that area of their home. So I think that this is something that is really impactful. Thank you.
Thank you so much. Anything else from anybody? I'll just note as you're pondering that, whether you want to ask something, that we've been asked in the different committees to hear proposals in capital investment that relate to our committee, but this would come out of the capital investment budget, just to confirm. Okay, anything else from anybody? Not seeing anything. So Ms. Summerfeld, thank you so much. Representative Lee will have you head to the front. And as you do, I'll note that we do have a quorum, and the second set of minutes, I think, are not quite ready. We need to make a change to that. But the minutes from March 19th, I'll see if there's, so we do have the roll, or have a quorum present. And so if I can have a motion to approve the minutes of March 19.
A motion, Mr. Chair.
Thank you, Madam Vice Chair. So Vice Chair Keeler moves approval of the March 19th minutes. Any additions or corrections? Kind of lengthy. Hearing none, all in favor of approval of the March 19th minutes, please say aye. Aye. Any opposed? Okay. Thank you. Vice Chair Keeler, your motion passes. Those minutes are approved for March 19. And then Representative Lee moves House File 3699 to bring that before us. And so Representative Lee, if you can please present your bill.
Great. Thank you, Chair and fellow committee members. This morning, I'm presenting House File 3699, which would appropriate one-time general fund dollars to support the continuation of a very successful child care facility revitalization grant program that has helped centers across the state be able to enroll 7,000 more children. Originally established in 2021 and funded with American Rescue Plan dollars, the Facility Revitalization Grant Program has improved the safety and quality of thousands of childcare settings across the state, hence these 7,000 new seats. As we've heard in this committee in the preceding weeks, the infusion of funds from the pandemic The infusion of federal funds from the pandemic helped address existing issues that were only exacerbated. And as COVID assistance funds phase out, families and organizations across Minnesota are turning to the legislature. To address the ending of ARP funds for this program, House File 3699 would appropriate $18 million to continue the Facility Revitalization Grant Program for an additional 3 years. And while we've heard many proposals for how the target in this committee could be used to reinvest in our state, this revitalization program would arguably give the state one of its best returns on investment. With an average grant award of approximately $9,000, program grants would bridge the financing gap, particularly for small, rural, and BIPOC-owned or culturally specific providers who often struggle to find private sector funding. This morning, I have with me Suzanne Pearl from First Children's Finance, the organization that DHS contracted to administer the program. I'm going to turn over to her so that she can provide more details on how this program differs from other child care facility grant programs, and she'll be able to share more about the unique aspects of the program and how it's benefited grantees.
Thank you so much, Ms. Pearl. Welcome. Please identify yourself and proceed.
Good morning. My name is Suzanne Pearl. I'm the Minnesota Director for First Children's Finance. Thank you, Representative Pinto and members of the committee. I'd like to thank Representative Lee for authoring the bill. I'm pleased to have the opportunity to speak with you today about the Minnesota Child Care Facility Revitalization Grants Program. All available funds have now been granted, and I'm here to share the successful results of the program and why we believe it should continue. The program began with an appropriation from the 2021 legislative session using one-time American Rescue Plan Act funding. In designing the program, and after engaging directly with child care providers, we wanted to ensure that funds were equitably and widely distributed. To that end, unlike other child care grant programs, funds are provided upfront rather than a reimbursement and do not require a match. And this is the first facility-focused state grant program that licensed family child care providers have been able to apply to directly without a fiscal agent. The program set an award cap of $20,000 for centers and $15,000 for licensed family child care. Tribally licensed childcare was also eligible for this program at the same funding level per provider type. We held competitive grant rounds about every 3 months, 8 rounds in total. Applications were evaluated based on how much the funds would impact health and safety of kids, whether they address licensing needs, and the level of childcare need in their location, among other factors. If awarded a grant, grantees received 90% of the award up front, and they had 6 months to complete their projects. They then had to submit receipts, documentation, and photographic evidence of their completed project to receive the final 10% of their award. If they spent less than the full award, or we discovered that some of the funds were used for ineligible items, they would not receive the 10% payment and/or would be invoiced for the difference from their initial 90% payment. We are happy to report that the grant compliance rate has been very high for this program.
And hey, Ms. Pearl, I'm just going to pause you for a second. For members and members of the public, the second half of the packet that we have includes a report called Minnesota Child Care Facility Revitalization Grant Impact Report from December. And I'm finding that useful just as to see, and I would encourage other folks as well. It should be in the second half of you should have a packet that has some letters in the front, but then the second half of that packet contains this report. So sorry to interrupt. I just thought folks would find that useful.
Not at all. Thank you, Mr. Chair.
Please continue.
Of the more than 2,700 child care businesses who have received grants, to date, only 20 have been referred to DHS for noncompliance. We also had an independent audit of the program done last fall, which was successfully completed with no findings. In total, we awarded more than $31.2 million to 2,725 unique child care businesses across Minnesota. The average grant award size was just over $9,000. 69% of grants went to licensed family child care providers, and 31% went to child care centers. 58% of grant dollars were awarded to businesses located in greater Minnesota, with 42% awarded to businesses in the 7-county metro area. And across Minnesota, 15% of grants were awarded to child care businesses whose owners self-identified as people of color. Grants were used for a variety of projects and equipment, with the majority of funds used to repair or purchase flooring, fencing, outdoor play areas and play sets, appliances, and windows. The total enrollment of the 2,725 child care businesses receiving funds is more than 67,000 children. That's 67,000 Minnesota kids who are now benefiting from safer, healthier environments. This grant program also resulted in an increase of almost 7,000 new child care slots, which is fairly amazing, since due to federal regulations, we were not able to use these funds to build new facilities or to expand the size of any existing facilities. But these small grants had a big impact, helping child care providers to make better use of their space so that they could increase enrollment within their licensed capacity. We've heard from countless providers who have told us how much these grant funds have changed, not just the financial sustainability of their business or their ability to even stay in business, but they also stress how positively these grants have impacted the families they serve. Minnesota can and should be proud of this investment in child care facilities. We are asking now for funding to continue the program on a smaller scale to provide grants for child care programs who now and will continue to need support for facility repairs. This program complements and does not replicate other existing state supports, including the DEED Child Care Economic Development Grants and the Great Start Compensation Support Payments. The Facilities Revitalization Grant Program provides equitable opportunity for all child care programs in Minnesota to ensure safe and healthy facilities for the children in their care. Thank you, and I'm happy to answer questions.
Thank you so much, and thanks for your work. And this report is really helpful, and it's great to see the impact that's. I'm kind of amazed by the numbers. So more than 2,700 businesses and nearly 70,000 kids. Anyone else who wishes to testify on this bill? Member of the public? Not seeing anybody. And so member discussion, questions. Representative Coulter, you're up.
Excuse me. Thank you, Mr. Chair. And really, I just want to say thank you, Representative Lee, for bringing this forward. I introduced a strikingly similar bill, which led to some awkward conversations earlier this year. But I think this is an important conversation because I think it gets at some of those other sort of less realized costs of running a child care business and making sure that providers can serve kids. I've told this story before, but I talked to a provider, I think in Mountain Iron, who had to spend $600 to fix her fridge because it was a few degrees too warm. And that all goes into how sustainable a child care business is. So I'm just really, really pleased that we're having this conversation and hope that we can do something this year. Thank you.
Thank you so much. Any other member discussion? And so seeing none, Representative Lee, final words on your bill.
Great, thank you, Chair. Like I said before, I know it looks like we have a really big target, but we actually don't. And I know we have limited ongoing funds. And so if the committee were to consider, where to put these dollars to get the best return on investment for the state, I would suggest House File 3699.
Thank you so much. Okay, and thanks, Ms. Pearl, to you and to all who've been working on this. I remember when the program got set up and just really excited by the impact it's had. Thank you so much. So with that, the chair lays over House File 3699. Representative Keeler, I think you. Well, let's just continue the theme. Yeah, if that works. Yeah. So Representative Keeler has House File 3826 and moves that to bring that before the committee. So we'll give her a minute to get settled in. And I believe that there is also a DE1 amendment that we will get that in the form that she wishes once she gets settled in. And Madam Vice Chair, once you're settled in, you want to move the DE1 amendment? Is that your desire?
Yes, Mr. Chair.
Okay, so then members, I'm thinking we'll just approve this and get the bill in the form the author wishes. So all in favor of approval of the DE1 amendment, please say aye. Aye. Any opposed? Okay, motion passes. The bill is amended as you wish. Vice Chair Keeler, please proceed.
Thank you, Mr. Chair and members. One of the things that I have done since being on this committee is really have deep conversations in my community about childcare and how that actually plays out in our communities. I've worked really closely with one of my child care centers who unfortunately couldn't make it today for two reasons. One, the weather, we're greater Minnesota, and the workforce shortage. If she took the time to come here, she would actually have to close a classroom. So she does have her written testimony in the packets. I would appreciate us to take the time to read that because her story is really powerful in this work. So I do want to take a minute to make sure we all know that is there. What this bill does is it is an appropriation for grant funding to help what we call the CDA, or the Child Development Association's accreditation. It's, in practical purposes, it's when a daycare hires somebody who doesn't have the higher education credentials that we need to be a teacher. This is the way that we educate them. It's 120 credits. It takes roughly 6 months. If they stay diligent on track, it's about 2 hours a course. And what this ends up costing the child care provider is roughly $750, which we know, and what we've learned in this committee and in other conversations, is that when the child care providers have to offset costs like this so that the workers don't offset the costs like this, it ends up being the cost of the parents. And so it's just a way strategically that we think that maybe we can help impact the cost of what it costs to the parents, but also provide opportunities to educate individuals into the workforce. And so with that, Mr. Chair, We'll go to questions, and we do have a testifier, actually.
Okay, yeah, and we certainly do want to direct folks' attention, as Vice Chair Keeler said, to there's 2 letters in the packet, but in particular one from, the one from Nicole Flick, ABC 123 Child Enrichment Center, and then Mr. Burke, please identify yourself and proceed with your testimony.
Thank you, Chair Pinto and members of the committee. My name is Sean Burke. I'm with O'Connell Consulting. We represent Kids Count on Us, a coalition of childcare teachers, providers, and parents around the state. Several teachers and childcare providers would have also liked to have been here today, but as Ms. Flick, as Representative Keeler said, and just like Ms. Flick, they are navigating the weather and helping care for kids this morning. First, we really want to thank Representative Keeler for bringing this important bill. As the committee has heard before, we have a shortage of qualified childcare providers and teachers in this state. So one way to address this shortage is to help fund the educational credentials that childcare teachers need. As Representative Keeler said, the CDA is an important credential that can take the place of a bachelor's degree. In addition to the 120 hours, it also includes the completion of a professional portfolio, and a teacher gets to work with a training professional and learning coordinator to get better at their job. Hiring quality staff who are educated to perform the critical tasks of childcare and early learning is really difficult, and it's very expensive. It's actually the #1 reason we hear from providers about why they have waiting lists. We simply don't have enough trained and well-compensated staff to provide the care and learning. CDAs generally cost around $1,000. That can be more or less depending on where you are in the region. There's also additional expenses if you need translation services or and to cover the ongoing renewal costs. So this may seem somewhat inexpensive, but in a field where operating margins are so low, CDAs are actually very costly to teachers and providers, and they're being borne by the providers and the teachers themselves. Here's 3 very brief snapshots of providers around the state. In northern Minnesota, we have a provider who spent almost $4,000 last year to help her staff cover the CDA costs. We have another provider in the metro who can't afford it, and so the teachers themselves are paying $1,000 per person, including the testing. And then another provider also in the metro whose staff do not speak English. They have to pay additional costs for other classes and translation services to complete the courses in the CDA. The grant money in this bill will enable these providers and teachers to save money that we're currently spending on these credentials. Again, the per-person cost is a modest investment, and it's a big deal for these childcare providers and teachers. So we would ask that a modest investment from this committee would have significant returns in this area. And again, thanks to Representative Keeler for bringing the bill.
Thank you, Mr. Burke. Any member of the public who wishes to testify on the bill? Seeing none, so member discussion or questions? Representative Hicks.
Thank you so much, Representative Keeler and Mr. Byrd. I was unaware of how costly this is for providers, and so I think this is a wonderful way to expand our workforce behind the workforce, and so I'm really grateful for this bill. Thank you.
Thank you so much. Representative Zalesnikar.
Thank you, Chair, and thank you, Representative Keeler. I've talked to you quite a bit about childcare in Greater Minnesota, and what I like about this bill is this is a bill that helps the entire state. This is a bill that many people that I've talked to have questioned what we're doing as far as supporting people for the cost, because it doesn't sound like a lot, $750. It's kind of like the same thing with CNAs and that whole thing when we have such a shortage, finding ways to get people that are qualified and increase that pool. Who can be a great child care provider might look different. And so you and I have had conversations which I've appreciated, and I've wanted to see programs like this that are going to expand beyond the bachelor's or the associate degree to encourage people that would be fantastic people to care for our kids. And I think this closes the gap, so I'm happy to see it. So thank you.
Thank you. And so seeing no other discussion, back to Vice Chair Keeler for final comments on the bill.
Thank you, Mr. Chair and members, for the conversation. And also, thank you to the community members. I know they're not here, but I know that they're listening to really engage with us in this process. This was an idea that really stemmed from my community, so I do want to take the minute to acknowledge how wonderful that is when it works and when we are able to have conversations about like-minded communities across the state. So thank you for that, and I appreciate your support.
Thank you so much, Vice Chair Keeler. Yeah, and I will note I was struck, despite focusing a lot on this issue area, about how you couldn't have, Ms. Flick couldn't come here, and it's not just because it's sort of like a particular day, like this is the life of somebody who's providing childcare and early learning services. Like there's not, you think about somebody gets sick, you need a day off for some reason, like it's an impossible spot to be in. So anything we can do to help, and this is an example of that. So thank you so much, Mr. Keeler. So with that, the chair lays over House File 3826 as amended. I would think we've got a bit of a delay on a testifier for another bill, so I'm going to swap places with Vice Chair Keeler and head up to bring up House File 4697, just for folks following along.
Chair Pinto, House File 4697 is in front of us. What's your motion?
My motion is just to move House File 4697 before us, Madam Chair, and it'll end up getting laid over.
Sounds good. Go ahead and describe the bill.
Thank you so much. So members, let's see here. So House File 4697 relates to the process for reviewing fatalities and near fatalities in the child protection system. This is an issue that is a huge, that has been a concern of mine in particular since the series of news reports from the fall about our child protection system and discovering that there were a number of concerns about it. What this article found, there was just a quote from the very first article in the Star Tribune series, finding that sort of compliance with our current process is really spotty. It's fragmented and complicated, but there are a number of issues relating to it. And so I have been spending a lot of time since November putting together the bill before you, 4697. I should say that it continues to be a work in progress. Just yesterday had an hour-long meeting about it and continuing to do that again tomorrow. So this will continue to work. But basically, stepping back, when a child dies or nearly dies because of determined or suspected maltreatment, it's critical to conduct a systemic review to figure out what, if anything, could be done to improve our policy or practice. And this, I should note, is distinct from investigations that might go on into who may be at fault and maltreatment investigations, et cetera. Those sorts of things do occur, but we really do need a systemic review. And our current process is complicated, it's confusing. It's based on compliance with the current system. It's not looking into how to improve the system as a whole. We're not making recommendations currently to system partners, such as the judicial branch or law enforcement or the legislature. It has to wait for the conclusion of litigation currently, which can take years. It really lacks transparency in terms of recommendations being made. And just to quote from that first article that I mentioned, it said that a survey of more than 24 counties shows the compliance with the current requirements is spotty. Some counties fail to conduct required reviews, others take years to complete them. And there was a quote that a senior leader could not think of a single policy or procedure that changed as a result of the reviews in the past 5 years. And so this has been developed in consultation with a number of members of the existing panel and other input as well to make sure that we do have a system that actually works. The basic structure is that when there is a critical incident, an incident where a child dies or nearly dies or maltreatment is suspected, it is reported quite quickly to Department of Children, Youth, and Families and to a state panel that is established. And then there is either a local review conducted or a joint review jointly between the local county and the state to look into what are some lessons we can learn from this. And then there may be some specific recommendations coming out of an individual incident, but eventually a report that comes out from the state panel saying how can we improve things. This is, to my mind, this is an extremely important and high priority thing for us to be working on because we should be learning every possible lesson we can when we do have one of these critical incidents. I have no testifiers, Madam Chair, and I'll be happy to talk with committee members after we see if any member of the public wishes to testify. Thank you.
Sounds good. No testifiers listed. Anybody from the public testifying on this bill? Seeing none, we'll go to member discussion. Representative Hicks.
Thank you. Thank you, Chair Pinto. I have just a quick question. When I was reading the definitions, I noticed it talks about in licensed facilities, which makes sense. But I was wondering if there's a child fatality while a family is in assessment, would that be reported and monitored by this board, or would that exist in a different space?
Chair Pinto.
Thank you, Madam Chair. And actually, the structure of the bill, Representative Hicks, great question. It's a very confusing structure of the bill just because of how the sections work, because it's actually the opposite of what you're asking. So Section 1 references fatalities and near fatalities in licensed facilities. Those would remain under Department of Human Services review, because of course they handle licensed facilities. There's a process, that's that. Section 2 of the bill is the panel. And yes, if there's a family that is in assessment, that is in investigation, or even where maltreatment has been determined, maybe a contributing cause, but perhaps even not an assessment, that's something that this panel would be addressing. So the licensed facility is actually a separate thing. This is not deaths and near deaths in licensed facilities. Thanks.
Representative Hicks.
Thank you. I was confused. I appreciate the clarification.
It's confusing.
Any other member discussion? Seeing none, Chair Pinto, final words on your bill.
Thank you so much, Madam Chair. And so again, members, to my mind, this is really important to avoid knee-jerk policymaking, to make sure that we're thoughtfully working through and thinking through, and that we are in fact getting lessons from critical incidents that occur. Again, when this comes back before you, as I hope that it does, I'm expecting there to be some changes, but this will be important for us to put into place. And thank you, Chair, and thanks, members.
Thank you, Chair Pinto. As the motion is, it will be held to be laid over. House File 4697 is laid over.
Thank you, Madam Chair. And then, Chair, I'm not sure if we have whom we have, but,
I think my crew's here.
oh, okay. Swap again. And Vice Chair Keeler moves House File 4950 to bring that before the committee. I don't believe there are any authors' amendments. Oh, yeah, but I'm usually wrong, that's true. But I think this might be the rare case where I might be right. There are not. I'm being told that there are no authors' amendments, so this time I was right in saying that. So Vice Chair Keeler, please present House File 4950.
We're good, thanks. Okay, thank you, Chair and members. So one of the things that we've talked a lot about is data and how it tells a story, and we've done a lot of work digging into the homelessness world, digging into the youth world, but the intersectionalities of who we are is really complex. So what this bill does is it allocates $150,000 to the Wilder Foundation to do a study on the intersectionality of homeless individuals who are pregnant and parenting and how that impacts their unique needs. I'm not going to talk much on this because actually I have a fantastic testifier and individuals who can help ask questions, and for the sake of time, we'll move to my testifier.
Excellent, please. Yeah, welcome to you. Please identify yourself and proceed with your testimony.
Thank you, Chair and members of the committee, for this opportunity to speak. My name is Lily. I use all pronouns. I apologize in advance for my voice. Last week I lost it, and I am trying to gain it back.
No problem. Yeah, take it easy.
I work at the Link as a youth specialist, and I was also a program participant in the past. I was in one of their housing programs and then moved into one of their family housing programs after my wife became pregnant. When I was 19 years old, she was pregnant with my son and was living in her car. There were many hoops that we needed to jump through for my family to get support with housing. Things like our sexual orientation and gender identity were held against us because it did not always fall under the family definition. We weren't married at the time, but luckily the Link allowed my pregnant wife to move into my studio apartment. The caseworkers worked hard to get us accepted into housing together despite the many barriers due to our young age, marital status, and parentage of our child. There is so many more barriers that I could discuss, but we are on a time limit. I know we need more programs for young moms and young families who are just learning to survive as an adult. I believe it is important to invest into this bill, HF 4950, so we can help more young moms and families because they are our future and stability needs to begin in the home. There should never be a reason for young families to be excluded from important life-changing services and housing. Thank you.
Thank you so much. Thank you for being here and for your testimony. And then Beth Holger is, I believe, listed as a testifier as well. Looks like making your way on up. Well done. And take care of that voice, Lily. Yeah. Ms. Holger, welcome. So glad to have you. Please identify yourself and proceed.
Thank you, Chair Pinto and members of the committee. I also want to really thank our chief author and champion, Representative Keeler. Thank you. My name is Beth Holger. I work with the Link, and I'm also on a part of the Youth Services Network, which is a statewide coalition of homeless youth serving organizations. I'm here on behalf of both. The Link, as you know, operates many shelter and housing programs for youth and young families experiencing homelessness or sex trafficking. And we do have fewer organizations that provide specific housing programs due to the complexities for young families. So the Link, but also our partners Avenues, Lutheran Social Service, and the Bridge also have housing programs specific for young families. So I just want to make sure that's known. All of us see firsthand many stories, such as the one Lily told, of single mothers, single fathers, pregnant young people, same-sex couples, that are experiencing homelessness while also trying to raise their young children, and they're still youth themselves. So they have unique needs that are very different than their adult counterparts in the adult homelessness system. And so what we would love to do, is to have this study be passed, because House File 4950 be passed, because we want to figure out the statewide number of young people experiencing pregnancy and parenting while they're homeless, and also figure out what exactly we can do as a state to better support these young people and their specific needs as they're trying really hard to raise their children at a very young age and in a crisis situation. We also would be able to just figure out how to strengthen our systems and build up our much needed critical services for these young people that deserve all the love and support that they can get. I want to also just really thank you all for your strong support and investments in the Homeless Youth Act and all of the homelessness areas of funding last year. It's incredible progress, and I do believe this study will help us really even create better investments and strengthen our support for young families across the state. One last thing I will say is that this study will absolutely involve young people with lived experience of homelessness as a parent or experiencing pregnancy as a homeless child, as they are the experts, and then we're adding in the expertise of a research organization, so it would definitely include their experience. Thank you so much. I appreciate your support.
Thank you. Thank you for your testimony. Is there anybody else who wishes to testify on the bill? Member of the public? Not seeing any. And so member discussion. Questions? I'm going to see if there is. We're quiet this morning. Okay, and so Vice Chair Keeler, going back to you.
Thank you, Chair and members. I think it's just really important that we can utilize data to be able to develop highly accurate approaches to support individuals across the state, and that's really what this study helps us do. So thank you, and thank you for your support.
Thank you, Vice Chair Keeler, and thank you to Beth Holger and to Lily as well. I'm so glad to have you. So with that, the chair lays over House File 4950. Thank you so much. And then Representative Hollins, you're up next. House File 4192. And maybe I'll ask Representative Katiza-Watun, would you mind moving House File 4192? Bring that before the committee?
Mr. Chair, I would move House File 4192 for consideration.
Thank you. And then Representative Hollins, you got a DE1, and do you wish to have that brought before us as well?
Yes.
Okay, thank you so much. Representative Katiza-Watun, will you move the DE1 amendment for Representative Hollins?
Mr. Chair, I would move the DE1 amendment.
Thank you. Members, since this is a DE1, I think what we'll do is just add it on, get in the bill and get the bill in the form that Representative Hollins wishes. And so, not seeing any discussion about it. All in favor of the DE1 amendment, please say aye. Aye. Any opposed? No, I do not know where my gavel is. There it is. That's how we know it's official. Okay. So House File 4192 as amended is before us. Representative Hollins, welcome, and please proceed with your bill.
Thank you, Chair Pinto. Thank you, committee members. House File 4172 is a bill to perform a transparent, independent external analysis on the complex streams of funding available to Minnesota's child welfare system to better understand and develop opportunities to repurpose and reinvest additional federal and state funds into preventative services for counties, tribes, and families that need them. For too long, we've relied on county and tribal partners to carry too big of a financial burden for our child protection system. As compared to many other states, Minnesota as a state invests a lower amount into child welfare system and the people impacted by that system. And we rely more heavily on county funding, which comes from county tax dollars. This bill gives Minnesota an opportunity to gain a more nuanced and complex understanding of available funding, but also provides critical external and independent oversight into how Minnesota is investing and spending its funds in the child welfare system to counties and tribes. The bill creates a working group to support the efforts of the independent external consultant, and ultimately the bill requires both a fiscal analysis but also programmatic and recommendations and practice models to help Minnesota prioritize prevention services equitably across the entire state. I want to note that the amendment that we added on adds a requirement for consultation with tribes pursuant to Minnesota policy. It creates an opt-in option for tribes who may choose to not participate in the study. It adds programmatic recommendation and practice model component because after meeting with stakeholders, it became clear that there was a strong desire to add practice model and program component to the bill. And it amends the time frame of the project to allow for additional recommendations. So many constituent groups and individuals have come together to help draft and support this effort, including DHS, the counties, Leech Lake, and community advocates and service providers. And I do have testifiers.
Okay, welcome to the committee, back to the committee, and please identify yourself, Ms. Woolman, and proceed.
Thanks. Nice to see you, Chair Pinto.
Hello.
Good morning. It was interesting getting here this morning with the weather. My name is Joanna Woolman. I'm the Executive Director of the Institute to Transform Child Protection at Mitchell-Hamlin School of Law. I'm also a professor there. I've spent more than 20 years practicing in the child welfare arena. I represent parents predominantly and relatives in child welfare cases. I am here today to support this effort because I am concerned about policy reform and especially reform that supports prevention services and better practices in Minnesota's child welfare system. Just a couple things I'll say because I know we have a brief amount of time. There are areas I think where Minnesota may not be capturing available funds or sharing or dispersing them in equitable ways across the state. And practice equity is a huge part of this bill and trying to figure out how we can make sure that no matter what county you're in Minnesota, you have an equal opportunity to receive practice and services that work for you and your family, that are culturally appropriate and that are equitably dispersed and supported. I do want to say a little bit about the stakeholder engagement. There's been quite a bit. We've brought together a large group of community providers who actually provide services to families around Minnesota. We've worked with the counties who are supportive of this effort. The Minnesota Indian Affairs Council has also signed off on this effort, as well as Leech Lake. We've worked with the ombudsperson for foster youth, and we've also worked with a variety of community activists and community advocacy groups. I think the timing of this bill is really critical with the start of the new department to give them a baseline understanding of what the federal stream looks like and what the state contribution looks like. And I also would just say in closing that this bill is really not about the money, although it does call for a fiscal analysis. Ultimately, I think at its core, this is a commitment to the thousands of children and families in Minnesota who end up in our child welfare system. And it's telling them and reminding and reassuring them that we are doing everything we can to ensure access to services and support in all counties and for all families. I'd be happy to answer any questions. Thank you.
Thank you so much. I think that's the only scheduled testifier, but just seeing if any member of the public wish to testify. And not seeing any, oh, perhaps there is. Oh, there you go. And you probably are, I think you were, in fact, I think I was where you were going to be testifying, Sanderson Sedbridge. So please identify yourself and proceed.
Good morning, Chair Pinto and members of the committee. My name is Kirsten Anderson. I'm Executive Director of Aspire Minnesota, a statewide association of child and family service providers, and I'm here to support House File 1492. Community-based organizations know that achieving child and family well-being is complex and reliant on a variety of supports, including mental health, disability, and contributing social determinants of health. And foundational to child and family well-being is a child and family-centered, culturally responsive child welfare continuum. Though our child welfare system has strengths, the overrepresentation of children from Black, Indigenous, and wider communities of color is a systemic problem that requires an accountable statewide continuum. An independent analysis of funding and practice models in Minnesota creates opportunity for shared understanding to support developing those statewide services. Minnesota is consistently ranked as having one of the lowest investments in child welfare. This general fund measure does not account for local investment or other federal resources funding family preservation. It is critical to understand the totality of resources that Minnesota is leveraging and what federal opportunities could contribute to developing a statewide continuum of prevention and early intervention services. Today's child welfare system has too many disparities, with disproportionate representation of BIPOC children and geographical disparities, with significant gaps in care depending on a family's county or tribal welfare child agency. We believe Minnesota can build a child welfare system with statewide access to services that are culturally responsive, family-centered, and get to the root of our system's painful racial disparities. This study can support shared pursuit of those goals. Thank you.
Thank you so much. Any other member of the public? Not seeing anybody. So moving to member questions or discussion. Representative Hudson.
Thank you, Mr. Chair. Thank you, Representative Hollins. I'm curious as to why we wouldn't just use the Office of Legislative Auditor to accomplish this task as opposed to farming it out to a third-party independent contractor.
Representative Hollins. And we'll have Ms. Woolman come back. Yeah, no problem.
Pinto, thank you, Representative Hudson. I think that's a fair question, and I think there were several considerations that were brought to us that made us come to this conclusion. And I'll have Ms. Woolman.
Ms. Woolman.
Thank you. I think the key to this is really that we are doing an independent and external analysis, because one of the concerns we have is the capacity, I think, and sort of knowledge base of the department to access and understand all of these federal funds. And so we are looking for someone to come in who is not associated with any current agency to get a truly neutral look at what's happening. And the Office of Legislative Affairs does excellent reporting. However, I don't think that it brings the necessary independence to our current practices that would benefit Minnesota going forward, if that makes sense.
Representative Hudson.
Thank you, Mr. Chair. Thank you for that answer. I don't know that I agree with that assessment, but I appreciate you explaining what the reasoning is.
Okay. Representative Katiza-Atun is up next.
Thank you, Mr. Chair. And to Representative Hollins, I think that this is a really comprehensive proposal. We have heard so many different thoughts and ideas throughout this session so far on how we can do better for the children in our child welfare system across the state. And we've heard from the counties and how much of a struggle it can be to fund the programs and the supports that we know that would benefit children and families all across Minnesota. I was looking at the members of the task force, and I see that in line 4.12, there's a member appointed by the foster youth ombudsperson. I think it's so important to potentially have a youth representative or somebody who at least has lived through child welfare and out-of-home placement. I don't see, though, participation potentially from parents, either licensed foster parent or kinship care providers, because I know one of the issues that we've talked about is that sort of there's the official child welfare system and then the less official child welfare system when somebody is in kinship placement, and the benefits that those children and their kinship caregivers may not qualify for. So that's certainly something that we need to consider as we look at. So I think that might be a potential add-on to the members of that task force. And I think also how things kind of align, and as we shift into the new Department of Children, Youth, and Families, how it interplays between children in the child welfare system as well as how they're being supported in early childhood education. So considering potentially, the services that they're eligible for, but may not be the parents, out-of-home placement, kinship parents may not be aware of, like early childhood and family education that's available in their district, or some of these other programs, early intervention services, this sort of thing, so that when children are experiencing this trauma and they're experiencing this out-of-home placement, we know that they are so much more likely to have developmental delays. And so just meeting them where they are right as soon as they're having to process all of this, and making sure that they're getting the supports that they need, I think would not only help them and benefit them as they continue on into kindergarten and on, but it certainly is, and it was for me, a social support as a foster parent, that knowing other parents in my area and people who are going through the same thing, it really helped me and my husband not feel like we are going through this journey alone. And then in turn, that helped us be better parents to our kids. So thank you.
Thank you so much. I don't know if Representative Hollins, anything you want to say in response to that?
Thank you, Chair Pinto. Thank you, Representative Katiza-Wattoon. I don't have a response. I just think those are really thoughtful additions to it, and certainly something that we would take under consideration. So thank you.
Thank you so much. Just looking to see if there's other things. I'll have a couple of questions I want to ask, I guess. This had, as introduced, this had been really focused on a fiscal analysis, and then in the DE, it's expanded to program practice evaluation and kind of more broadly about policy. And just wondering, any comments about kind of how that came about and kind of what your thinking was in expanding to, it's even, I notice in the DE, there's a, I'm looking at the final paragraph, to contract with a third-party consultant to conduct the fiscal analysis and to contract with a third-party consultant to conduct a comprehensive evaluation of programs, practice, and services. Just wondering kind of how you expanded to have that programmatic and policy aspect of this as well. Representative Hollins or Ms. Woolman, or?
I mean, I'll pass it over to Ms. Woolman in
Yeah.
just a second, but thank you for the question, Chair Pinto. So I know when I talked to DHS, that was one of their primary interests in what we were doing with this. They said they didn't want it to just be a look at the financials, but also a look at how they can better organize their programs. But my understanding is there were several other stakeholders that also had that same concern, so.
And maybe we'll eventually ask DHS to comment on the bill as well, but Ms. Woolman.
Yeah, I think that's right. So initially, it had just been drafted as a fiscal analysis, and after speaking with the agency and with counties, it became clear that there was a desire not just to understand the funding streams, but then to really look at how we're prioritizing initiatives and whether or not sort of the amount of funding that we're putting into prevention, for example, is enough and is what we want to be doing. So I think there was strong urging from the department and from counties to not just stop at the fiscal analysis, but to actually go ahead and look at Minnesota's practice model in terms of whether our funding is matching the value proposition that we're hoping to provide. And I think with the passage of the Family First Prevention Services Act a couple years ago, there's a huge federal push to go upstream. And so I think part of this is also to really help the department, the new department, get a handle on the creation and establishment of prevention services across Minnesota.
Okay. So maybe I'll ask Ms. Sommerfeld, if you're here, or somebody else from DHS, if you can just provide any comments on this. And I know, Representative Hicks, I'm going to get to you next. We'll do this first and then call on you. Okay, so Ms. Sommerfeld.
Thank you, Mr. Chair, members of the committee. Jennifer Sommerfeld with the Department of Human Services. We did provide a fair amount of technical assistance to Ms. Woolman and Representative Hollins, and we were part of a lot of community discussions that took place about this bill and about looking at our system, both at the fiscal point and, as Ms. Woolman said, looking at how our practice models align with what works for children and families. So I think we thought that it was important not just to look at how are we maximizing federal revenue, how much does it cost to run our system? Are we low in state funding for child welfare compared to other states? But also, are the funds that we are using supporting children and families the best way possible? So we did make that recommendation.
Okay, thank you so much. Thanks for that comment. So Representative Hicks, to you.
Thank you. Thank you for this bill, Representative Hollins. I am starting to feel like a little bit of a broken record this year, but we know that there's a significant amount of people with disabilities interacting with child welfare, either kids or parents. And there are additional services that may be available to them, both on the prevention side and then post reunification or whatever sort of occurs, and during that transition that may be impacting. We're seeing children being called, families being reported to child welfare because they can't find placement for their child who's boarding in an ER. We're seeing children with significant disabilities being, having family conflict that results in abuse reports that in many cases were because nobody knew what else to do, right? So just wanting to sort of highlight that and encourage, if possible and if welcome, some kind of a specific call out to make sure that we're intersecting those services and those spaces, particularly with the new department and the separation from DHS and disability services and behavioral health services. I really think we have to be intentional and mindful to call those things out to make sure that they don't get forgotten in the shuffle.
Thank you so much. And if any comment on that, Representative Hollins or Ms. Woolman?
Yeah, I think it's a great idea. And I would love to communicate, talk with you offline to try to figure out how we could better integrate that into it.
That's good. Vice Chair Keeler.
Thank you, Chair. Thank you, Representative Hollins. So the bill has come a long way from the original language. I will say that. I appreciate that the stakeholders I've had conversations with and we've been making changes. I do just have a couple questions because the scope of this bill has changed a lot. It was originally just a fiscal analysis. And so my question is, so on the last page of the DE, it says that this money is to contract with a third-party consultant to conduct a comprehensive evaluation of programs, practices, and services in the child welfare system. Yet, on the first page, when we're actually going through the process to hiring a consultant, we only care about their understanding of fiscal analysis. So this creates a really big issue of concern, right? Because now we're asking, what we're saying is we're only gonna hire somebody who has fiscal analysis background, yet we're gonna start asking them to look into these programs on a much more comprehensive, in practical purpose things. And so the new concern I have is how the American Indian IRB process would be handled with this, because when you stay in a fiscal lane, it's different than when you start looking at practices. And I also do like that we took into considerations that tribes can opt into this or that they can choose this if they want, because our data is part of sovereignty as well. So, and we can have behind the scenes conversations about a little bit more, but I do think we need to address how we would pick the consultant in this process if we're only looking at their background in fiscal analysis.
Representative Hollins, to you. And
I
then-
think that's a fair concern, and I know Ms. Woolman wanted to respond.
Yes, Ms. Woolman, please.
I appreciate that. Honestly, I think we had been discussing initially just doing a fiscal analysis and then adding a programmatic component came later. And I think the department feels like there should be, and I think I would agree with this, an initial fiscal analysis and then a practice model created. And so it may be that we need to add language to clarify that the evaluation done by initially of the fiscal analysis would be by someone who has fiscal expertise. And when we contract with an independent person who may be the original person or may be someone different, that we certainly need to take into account expertise around practice and practice modeling. So I think that's, we need to clarify that, and I appreciate you pointing that out.
Vice Chair Keeler?
That's it.
Okay, thank you. Yeah, it does occur to me, Ms. Woolman, I can see the need for independence. You made that point in response to Representative Hudson's question about the need for independence regarding the fiscal side of things. I guess I can see the advantage on the practice side, although, if you're too independent, then you don't have knowledge about you do need to understand how our system works as well deeply, right? And so it does feel like there's a balance there. I will admit, when I think about the policy and practice part of this, it makes me think about some of the other proposals that are floating out there, like there's a proposal from Senator Mitchell and me relating to an advisory council. I'm expecting members that'll come up relatively soon. Might have some changes to it. So just kind of wondering about how you see this fitting into some of the other proposals that are out there to improve, to assess and improve our child welfare system. I guess, yeah, Ms. Woolman, to you. Yeah.
Thank you. Thank you for the question. It's a really good question, and I think there's sort of, I think there are organizations that in other places have done both a fiscal analysis and a practice model. I do think independence is important. With respect to how the other advisory groups might be a part of this, I think that's a really fair question and one that we should consider talking about, because I know that Representative Hudson has a bill for a task force, there's a bill that you and Senator Mitchell have for an advisory council, and there's the working group that's been created in this bill. And so I think it is worth talking about whether one of those groups could be a part of the practice or program component of this bill. One of the things I would also like to say in response to an earlier question is that creating a working group that's just going to be tasked with providing essentially information for a fiscal analysis is a really different endeavor than creating a working group that's going to look at Minnesota's practices and a practice model. And so I do think it might be worth considering the working group for this bill to focus on the fiscal analysis and then integrating one of those other task force or advisory councils around the practice component of this. I think that's a really good idea.
Okay. Representative Coulter?
Excuse me. Thank you, Mr. Chair. Couple of thoughts. First, I appreciate that this bill now does go beyond the fiscal analysis. I think as I have become more familiar with the child protection system, child welfare system, it's become very clear to me that budget decisions are policy decisions and policy decisions are budget decisions. And so I think it is important that broader consideration is there. I'm curious though, and this was sort of provoked by Representative Keeler's line of questioning. So there's the section where it details the consultant selection with regards to the fiscal analysis, and then there's the section starting on line 2.29 that deals with the consultant selection regarding the practice and program evaluation. And I'm curious, well, first of all, I would also request that perhaps some of the consultation sort of callouts in that first section on the fiscal analysis you may want to think about incorporating something like that into that second section as well, because I noticed there isn't anything there. But you sort of touched on this a little bit. I'm just curious kind of for what your thoughts are on how those interact and whether or not that those could be the same consultant or could be different, because I'm just not entirely clear sort of what the thought process is there.
Representative Hollins, or?
I'm 100% going to pass that
We're going to
over.
pass that over to Ms. Woolman, okay.
I think
Or
certainly
to
Ms.
somebody else.
Woolman can speak to this.
And, okay, we're going to have another tag team here to Ms. Sommerfeld.
Mr. Chair, members, Representative Coulter, I will say as we're talking through the legislation, we provided a fair amount of technical assistance over the weekend on this legislation, and there are probably some holes in it that need to be cleaned
Being
up.
laid over, so it's
just
conversation.
acknowledging that right up front.
Okay.
I think the reason that when we were working with Ms. Woolman on the legislation that we have separate consultants listed is we look at them as kind of separate reports. So they could be the same person, they could be the same entity, they could be a different entity, depending on how people respond to two separate RFPs. Because as Representative Keeler noted, we want to make sure that when we're doing the practice and program evaluation, that we're looking at people who have expertise in child welfare program and practice, not just expertise, on the fiscal side of things.
Kind of per the earlier question, Mr. Keeler, yeah. Representative Coulter, back to you. Okay, yeah. And a question that I have, pardon me, Representative Hansen, yeah.
Thank you, Chair. Thank you, Representative Hollins, for this. And this may be a question for Ms. Sommerfeld if she doesn't want to go too terribly far away. But my question is, how comprehensive do you feel this work is going to be given the state of SSIS?
Great question. Ms. Sommerfeld, Ms. Woolman, Ms. Sommerfeld, somebody is, I kind of think that you're on the hot seat for that one, Ms. Sommerfeld. Ms. Sommerfeld.
Thank you, Mr. Chair, members. I could not see because I was sitting on the floor. Who asked the question? Was that you, Representative Hansen? Thank you. Members, Representative Hansen, I think it can be fairly comprehensive despite our issues with SSIS. I think, in fact, SSIS is one thing that might come up as an issue that we have, a problem we have with our system, is a lack of data. And I think having somebody look at the whole system of how we're doing claiming, federal claiming for 4E and other things will help us highlight some of the things that we need to change as we are hopefully modernizing SSIS over the next few years. So I think it's possible to do it with the limitations that we have.
Representative Hansen.
Thank you, Chair, and thank you for that answer. I will say this with as much respect as I can, is that we keep hearing that. And unless and until we improve SSIS, I really worry about the quality of work a team like this would even be able to do, considering that they can't get the reports out of it that they need, that we're having trouble tracking that funding as it is. And so just for this committee and for the public watching, unless and until we invest in SSIS to really make sure that this is not an antiquated system, I would love for this team to be able to get the good work done that they can, but I have great concerns about how well they would be able to even evaluate a program or our money and where it's going without significantly improving the system first. And so I just think we just need to make sure we're thinking about the cart and the horse here and which one's going first.
Thank you so much, Representative Hansen. Representative Zalesnikar.
Thank you, Chair, and thank you, Representative Hollins, too. And I appreciate, Representative Hansen, your comment on the IT, because that's my question, too, is it's the cart before the horse. It seems to me that the job of this would not be able to be accomplishing the goal when we have heard over and over of this SSIS, and there's many other programs that are limited and how they're communicating, and we're not able to track the data right now. And so my concern is the infrastructure is just not there to do that, and we need to get that done. So I appreciate that feedback from Representative Hansen, because I think that has to be, it's just the timeliness of this request just seems to be premature before the IT situation is solved. Thank you.
Thank you so much. Yeah. Representative Hansen, yeah, no problem. Follow
Thank
up.
you, Chair Pinto.
Sure.
And I just wanted to follow up on what Representative Zalesnikar just said. I disagree a bit that I do think we need to do this work because families and kids need it. So I am not by any means saying that we should not get going on this, but I think also my message to the counties and to DHS is to hurry up and get SSIS done, because in order for this team to be successful, which I want them to be because it will drastically help us address some of the areas that we need to improve in, we got to make sure that this team, like I said, we set y'all up for success really is the biggest piece of this, and continuing to push on, from the counties continuing to push off, this research and this sort of evaluation has always been a concern of mine, and so I'm looking forward to the conversations that this will produce. But I also know that this will also say that SSIS is a problem. And so if we can just kind of get ahead of the curve on that and make sure that we're maybe not wasting the consultant's time and state taxpayer money in getting an assessment that we all already agree on, that SSIS needs to be replaced ASAP, that would be the biggest thing. But I do not want my comments to at all water down the sheer importance of this, because we absolutely need to get going on this.
Thank you so much. And we're going to have the letters SSIS ASAP right there in our minds. I just want to ask about cost to Representative Hollins, if this is to Ms. Woolman, to Ms. Somerville, not quite sure, but the bill as drafted was $250,000 for the fiscal analysis. I see it's a blank appropriation, the DE1. Am I right in thinking that the reason it's blank is because it still need to be determined the cost of the policy, of the second evaluation, so to speak, and that is the $250,000 you're thinking for that fiscal analysis, or kind of how to think about that? Ms. Sommerfeld.
Thanks, Mr. Chair, members of the committee. The $250,000 that was in the original bill was an estimate from advocates who drafted the bill. DHS has to fiscal note bills separately to determine what the cost is. Okay. So I think that's why it's in as a blank appropriation. That's, I think, generally what we prefer when it comes to issues where we'd have to issue an RFP and hire a consultant so we can determine the cost, look at the number of hours it might take to do something. I think in this, there's a vision of having a great deal of community engagement and understanding the practice model, which takes time and money and looping back with families and children with lived experience and those folks. So that's something we have to consider.
And am I right in thinking that the fiscal note then will get information about both evaluations, right? So sort of if the committee were to choose to do one rather than the other, then we kind of know the cost of the one, the cost of the other one, et cetera. Do you understand what I'm saying, Ms. Sommerfeld? We should
Certainly. Normally, we would do a bill as a whole, but we could certainly price that out separately if that was what you'd like.
I think that would be useful, I guess, and part of the reason I say that, members, is because of the overlap with some other policy policy work that's happening, as was referenced in the earlier questioning, whereas the fiscal analysis feels like it's potentially not duplicative of some of those other things, obviously an ongoing conversation. Mr. Berg, I think, has something to add. Mr. Berg.
Mr. Chair, I just comment, there is an open fiscal note on this that the department's working on the DEU adopted today.
Okay.
In addition to the 2 analyses you're talking about, the task force will also have costs.
Right.
And I'll just note the Senate has a fiscal note in on their amended version, which has 500,000 in the blank at this point, so.
Okay. But still a fiscal note, Mr. Berg, so we'll have to see what even comes. Okay. Good, okay. So, any other member in discussion or questions anybody has? A good discussion, though, about an important topic for us to address. So, Representative Hollins, final words on your bill.
Thank you, Chair Pinto. Thank you, committee members. I appreciate all the feedback. We're certainly going to try to incorporate more of that as we move forward. I guess my final thought would be, more information is good. It's good to make decisions based on data and not based on like feelings. And so when we get that information, hopefully we can make better decisions. So thank you.
Thank you so much, and thanks to Ms. Molman, Ms. Sommerfeld. Thanks for all the back and forth. We really appreciate you providing that. So with that, Representative Khadiza-Batoon, actually, pardon me, I guess, with that, House File 4192 as amended is in fact laid over. Final bill then, Representative Finke. As you make your way to the front, I'm going to ask Vice Chair Keeler to move House File 5036 before the committee.
So moved.
Thank you, Madam Vice Chair. Representative Keeler, welcome. Representative Finke, welcome to the committee. So glad to have you. I will note, members, Representative Finke represents my family and the district that I grew up in, so I'm especially very happy to have you before the committee because my family's delighted to have you as their legislator. So, Representative Finke, we've got the bill before us. I don't believe there's an amendment. I'm usually wrong whenever I say that, but I think that that's right this time as well. I'm being told I'm right. Excellent. And so, twice in a row. Broken clock is my day. So, Representative Finke, House File 5036, please proceed with your bill, and welcome.
Thank you, Chair Pinto and members of the committee. This being my first time presenting a bill, and for the record, my name is Lee Finke. My pronouns are she, her, hers, and I'm very grateful to represent the Pinto family. This bill is a direct ask from organizations and advocates working in the homelessness and 2S LGBTQIA communities. The need for it is urgent, and that urgency results from a compounding series of factors that are at play in Minnesota. The first is that trans, two-spirit, and gender nonconforming people experience homelessness at rates significantly higher than other demographics. Data shows that anywhere from 35 to 50% of trans people will experience housing instability or homelessness during their lives. The reasons for that are many: housing and employment discrimination and family rejection at the top of the list. The second factor is that queer people are moving to Minnesota. Minnesota is an island of protection for queer people in the upper Midwest and Plains states. According to the National Center for Trans Equality's most recent U.S. trans survey of 97,000 people, 47% of trans adults and parents with trans kids are considering moving out of state. That's an alarming number about the state of trans rights in this country. Like all communities, trans people want health care and protection. Minnesota's legal landscape is far from perfect, but the state of American trans rights is dire, and many people are looking to move. And finally, Minnesota's shelter system is not equipped to house the growing number of trans and queer people experiencing homelessness. That is also true of every other demographic of people who are experiencing homelessness. We don't have enough beds. Many of the shelters that are operating in the state don't make them available to trans people. Discrimination against trans people and our queer communities does not end at the door to our shelters. Queer homelessness is a complicated problem, and the first step to solving it is to get a handle on the situation. This bill was created in conversation with 12 organizations in the queer and youth serving communities. Those organizations have chosen our space to be the host of this research, but the work will be a collaborative effort to fully understand the landscape of LGBTQ homelessness in Minnesota. So very specifically to the bill, it is a $200,000 request for a needs analysis to study LGBTQ homelessness across the state, needs and solutions. There is a no later than ... That ... is December 15th, and that is the bill.
Thank you so much, Representative Finke. So confirming December 15th of 2024 is what you intend for that blank. Yeah, and the bill's being laid over anyway, so we'll have that in mind if we can fund it. So thank you so much. I don't believe you have any testifiers No? Okay. Any member of the public wish to testify on the bill? I am not seeing any, and so member discussion to the bill. Representative Perez-Vega.
Thank you, Mr. Chair, and thank you, Representative Finke. I just wanted to give a comment of the great work that Our Space Minnesota has been for our LGBTQ+ community, engaging so much outreach specifically for the youth, specifically those youth that don't have a safe space or don't find any ways of means of connecting. And this brings all that all together within our housing crisis that we have in our state. So these are very important initiatives that I look forward to supporting, and thank you for bringing this.
Thank you so much, Representative Perez-Vega. Representative Hudson, you're up next.
Thank you, Mr. Chair. Representative Finke, as I'm sure you recall, last year we received a report from the Office of the Legislative Auditor that indicated that we were having issues with best practices when it came to state grant management. And one of the specific issues that was pointed out was the naming by this legislature of specific organizations when we decide that we're going to make an appropriation and give out a grant. This bill does that, and I appreciate in your presentation, because one of my questions was going to be, why are we doing that? And you answered that. The community's asking for this. 12 organizations came together and tapped Our Space as the organization that should do this work. But in looking into the background of that organization, I'm a little concerned about our willingness to trust them with state funds, given the fact that there doesn't seem to be a very long track record to indicate reliability. We're talking about an organization that's only existed for about 3 years, and that not continuously, as I note on the Secretary of State website. They have on their website no annual reports, no financial disclosures, no financial statements of any kind. There's no information about how this organization is organized, their nature of their board of directors or organizational staff, save for 2 names. They don't have an IRS employer ID number listed. Their website itself is rather incomplete. There's spaces that kind of have placeholders in there. And they do not have, at least that could be found readily in an internet search, an IRS Form 990 to indicate anything about their financials. And so I guess what I'm wondering is you talk about 12 different organizations that participate in the process of tapping Our Space. That would seem to indicate that there's potential for competition for us to empower a commissioner to have a vetting process to determine who can best do this work. Why not take that approach as opposed to tapping specifically Our Space?
Representative Finke.
Thank you, Chair Pinto and Representative, for your question. It's a great question, and it's one I'm happy to address. So when the first conversation that this bill grew out of happened with someone from the organization Avenues for Youth, and they came to me and they said, we have this Q Connect program which serves queer children facing homelessness, and we are getting so many calls about 18 to 25-year-old trans people who are facing homelessness, and we don't service that community. So we need to do something. I entered into that conversation with them, and what I really loved about that conversation was very clearly they said, this is a problem we are dedicated to solving, and we will not be the organization who solve that because it is not our mission. But our mission is to solve this problem. So through a series of conversations, including some very direct conversations in which I called together all of these organizations and opened a conversation saying that very directly, this is not a sweepstakes. We are not looking to give money to a winner. We are looking to solve a problem. And if you are here to compete for money, you're not welcome in the space. Molly was on that call and can attest to how that went. What your analysis of Our Space is, the results of a brief analysis of looking at a website, and I recognize that that has value. I will say that when you pull together the trans community and you pull together who trusted voices who have been doing this work for decades, literally decades, who is the first person who was serving homeless youth of color, the first person to be recognizing the overlap of trans people in HIV communities in the mid-90s and early 90s. Who are the people who have been literally on the street serving trans people in need and are one of, if not the most trusted voice in the metro area for trans people? It is the executive director of our space. Now, the state of yeah, so I recognize, I'll stop there, but I'll say that in our community, when we do our own analysis, it looks different than allowing the commission to make that decision.
And back, and I'll maybe note, Representative, just I send back to you that there are a number of considerations about, I mean, we had actually an earlier bill even today that designated a particular recipient, right? So in terms of competitive grant versus designating, I feel like there's a number of factors that go into that, which we can get into, but I'll send things back to you to continue. Representative Hudson.
Thank you, Mr. Chair, and thank you, Representative Finke, for that comprehensive answer. That's the second time today that I've heard folks say that we can't trust our own nonpartisan state agencies, which is quite a thing to confess. We also heard earlier from Representative Hollins, which stood out to me, I wrote it down, that it's better to make decisions based on data and not on emotions. Couldn't agree more. I mean, when you talk about a simple analysis of just looking at a web page, if the information's out there to find, by all means, highlight it. But as it stands, given the data that we're presented with in terms of the financial reliability of this organization, I have more objective cause to trust a verified seller on eBay than I do to trust this organization. In terms of knowing that they're trustworthy. And what you provide me is your personal trust in the executive director, which certainly has value. But in terms of our guardianship of taxpayer dollars as a state, I think we perhaps ought to look for a little bit more than that. But I do agree with you on one thing, and I think it's really, I'm glad you brought it up because I think there's a potential for further work on this point, and that's the whole idea of it being a sweepstakes to reward the winner in these competitive bid processes. I've certainly heard outside of this conversation that process, the whole competing inside a community for who gets the money to provide a service, works at odds with the stated purpose of whatever program or service it is that we're trying to provide. And so is there a better way to do this than through a process that looks like a sweepstakes? I would say that's a question very much worth looking into. I don't know that the better way to do it is to just pick a person and say they get the money. I appreciate it.
Thank you, Representative Hudson. I'm going to turn to Representative Hicks. Obviously, you'll get final words on your bill, Representative Finke. Representative Hicks.
Thank you so much, Chair. We've had a lot of discussions about grants in the nonprofit space in this community and in many. And I think one of the things that we forget to talk about is that even if it's a named grant, you still have to do reports. And although we have had conversations about how named grants sometimes can limit departments' abilities, it doesn't erase the responsibilities that nonprofits have. And it doesn't erase the good measures that they put forth. And it doesn't stop the ability to put checks and balances in place. And since some of the concerns that have been brought to this legislative body, we have changed the internal mechanisms within many of our state agencies to account for some of those things. I see value in both ways. When we do competitive RFPs, we are by nature tend to be able to choose people who have grant writers and who have income to pay grant writers and who have a track record and staffing. And there's benefits to that. But it also limits the pool of people who are coming into the space with different expertise. And so I think that as a body, it's important that we find a balance in those things. And so I appreciate having the dialogue about how to find that balance and listening to communities when we do that. So thank you.
Thank you so much. And Representative Perez-Vega, you had something further you wanted to say or ask?
Yeah, thank you, Mr. Chair. And just to highlight, I mean, if we're basing things off of a website, I'd like to base things off of just a personal note into the reality of nonprofit work and sector. It takes a lot of growth. We have to hold folks accountable, but at the same time, I love the vetting process when it comes to our nonprofit sectors, to see the growth and the expansion and knowing about, our space and the dedication of their board and those leaders that came together, in particularly Roxanne Anderson, who has been an advocate in leadership for not just the state's LGBTQ community, but nationally known. Understands the process, recognizes the sectors and what has to go through on a daily basis. We're dealing with the reality that our trans community, specifically our youth, and I know a lot of those youth that have found space through this organization that came about from Culture Club, which is another great organization that has a partnership with them. Because the reality is that trans youth are subjective of committing suicide. And if they outgrow being a youth, they become an adult, that the reality is that they're going to have to face the challenges of suicide. And these are the organizations that have grown quite fast without having those stepping stones or open doors as other organizations have had, because the reality is that folks need a safe space to live. So there's roadblocks that have happened, there's trials and challenges, but I would like to say that I have not received any misleading information when I've asked to see their 501c3 status, when I've asked to see their updates on their 990s. So, at challenging times, maybe some folks in a nonprofit sector put a budget more towards trying to build that administration and staff work than they do on their actual website and webpage, because there's a lack of funding. And these are the supports of where those initiatives of funding goes to help grow an organization that can start from not just having 3 years of experience, but grow into 50 years of experience, like the other LGBT community organizations that we see and we celebrate that commemorate the work that's being done at Open Space. So thank you.
Thank you so much, Representative Perez-Vega. And Representative Finke, final words on your bill.
Thank you, Chair Pinto and members, for this conversation. I am grateful for your willingness to hear this, to recognize the importance of the issue. All of my work is rooted in data, and the data is clear that we need to move on this immediately. This is a long-term process for an urgent problem. And another thing I told all of those organizations is that the state doesn't solve urgent problems quickly. This is going to be a process, and we are going to make sure that what we do this year feeds what we do next year and the year after. So I appreciate being able to move this ball one step further down the road. That's a mixed metaphor. I'm sorry.
I think we got it.
That's all.
Representative Finke, thank you for your work, for making sure that that young people are taken care of. Really important. So with that, the chair does lay over House File 5036. And members, I believe, let's see here. So we do not have committee on Thursday, and I don't believe we do next Tuesday either because of the break. And so we will meet again a week from Thursday, and we'll be barreling on pretty quickly at that point towards having a budget bill. And I'll just encourage folks to please continue to be in touch. So with that, we are adjourned.